Thank you for your interest in Vet NeuroJar. Although we do our best to summarize veterinary articles, it does not replace the actual article. And if you are able to download and review the article yourself, please see the link in the description. This will summarize the article titled, "A randomized, controlled clinical trial demonstrates improved owner-assessed cognitive function in senior dogs receiving a senolytic and NAD plus precursor combination." Abstract. As pets age, they experience similar age-related declines in mobility and cognition as humans. These declines are associated with cellular senescence and NAD plus depletion. This clinical trial examined the effects of the novel combination therapy, consisting of a senolytic agent, LY-D6, and a NAD plus precursor, LY-D2, on senior dogs with mild to moderate cognitive impairment. A total of 70 dogs were randomly allocated to receive either a placebo, a low dose, or a full dose of the therapy. Primary outcomes were measured using the Canine Cognitive Dysfunction Rating, CCDR, scale, alongside physical activity monitoring through activity trackers. Results demonstrated a significant improvement in CCDR scores, particularly in the full dose group, indicating enhanced cognitive function. This study offers promising evidence for the benefits of targeting cellular senescence and NAD plus depletion in age-related cognitive decline. Study background: improved veterinary care has significantly extended the lifespan of dogs, leading to an increased prevalence of age-related conditions similar to those seen in humans. Conditions such as Alzheimer's disease and canine cognitive dysfunction syndrome, CCDS, are becoming more common. These conditions are characterized by cognitive and mobility decline, impacting the quality of life of both dogs and their owners. Current treatments for CCDS are limited, highlighting the need for effective therapeutic interventions. This study investigates whether a combination therapy targeting cellular senescence and NAD plus depletion could mitigate these declines. Understanding these mechanisms may also provide insights into human aging and cognitive health. Research significance: this study addresses a critical gap in clinical research, focusing on therapeutic strategies for age-related decline in dogs. Cellular senescence, characterized by the irreversible arrest of cell division, and NAD plus depletion, a critical coenzyme in cellular metabolism, are two key factors implicated in aging. By targeting these mechanisms, the study explores potential therapeutic approaches that could benefit both dogs and humans, enhancing longevity and cognitive function. Methodology: this study was designed as a double-blinded, randomized, controlled trial. Dogs aged 10 years or older, showing signs of mild to moderate cognitive impairment, were recruited and randomized into 3 groups: placebo, low dose, and full dose. The therapy regimen involved a monthly administration of the senolytic agent LY-D6 for 2 days, followed by daily doses of the NAD plus precursor LY-D2 for the remainder of the month. Primary outcomes were assessed using the Canine Cognitive Dysfunction Rating, CCDR, scale, a validated tool for measuring cognitive impairment in dogs. Additionally, physical activity was monitored using physical activity monitors, PAMs, to provide objective data on changes in mobility and activity levels. Secondary outcomes included assessments of frailty, owner-reported happiness, and adverse events. Participant details: out of 243 initial survey completions, 70 dogs were enrolled in the study. These dogs were assessed for eligibility based on age and cognitive impairment criteria. Following randomization, the groups received their respective treatments. Throughout the study, regular follow-ups ensured compliance and monitored for any adverse effects. By the end of the 3-month study period, 62 dogs completed all assessments, providing a robust data set for analysis. Results: cognitive function, CCDR scores showed improvement across all groups, with the most significant changes observed in the full dose group. This suggests that the combination therapy effectively enhances cognitive function in aging dogs. Physical activity levels, monitored through PAMs, did not show significant differences between the groups. This indicates that while cognitive function improved, physical activity levels remained relatively stable. Secondary outcomes: improvements in frailty and owner-reported happiness were more frequently noted in the full dose group. Although these differences were not statistically significant, they suggest potential additional benefits of the therapy. Adverse events were similarly distributed across all groups, indicating a favorable safety profile for the combination therapy. Discussion: the findings of this study highlight the potential of targeting cellular senescence and NAD plus depletion to improve cognitive function in aging dogs. The significant improvements in CCDR scores in the full dose group support the efficacy of the combination therapy. While the changes in physical activity were not significant, the observed trends in frailty and happiness suggest broader benefits. These results are particularly relevant for developing therapeutic strategies for age-related cognitive decline in humans. By addressing the underlying mechanisms of aging, this approach holds promise for enhancing cognitive function and quality of life in both dogs and humans. Conclusion: in conclusion, the combination of a senolytic agent and a NAD plus precursor demonstrates promising effects on cognitive function in senior dogs. The significant improvements in owner-assessed cognitive function over a 3-month period suggest potential therapeutic benefits. While further research is needed to confirm these findings and explore long-term effects, this study provides a strong foundation for developing interventions targeting cellular senescence and NAD plus depletion.